Joining us on the program now is Graham Kelly, the CEO and MD and founder of Noxopharm. Thanks for joining us, Graham.
Thanks, Peter.
So, for people who don't know what Noxopharm does, in a nutshell, explain it to us.
We are focusing on cancer and looking at bringing a drug to market or through the clinic anyway, that's called Vyondra. And it's a drug that whose job it is to activate the body's immune system to fight cancer. So that's our focus, and we're probably halfway towards achieving our goal.
All right. Now, you have appeared at some of our micro-cap conferences, and I've noticed, in Feb, the share price got up to about 99 cents, and it kind of coincides with your appearance at the annual ASCO GU Cancer Symposium, which I'm sure you'll explain to us what all that is about. But tell us why the company's share price has done well recently.
Okay, well, that conference you're referring to, it's probably the world's biggest cancer conference in relation to the GU stands for genitourinary cancers. That's cancers of the genital tract of men and women, and in the case of men, it's predominantly prostate cancer. Yeah. So it's where the big companies and little companies go to talk about the latest developments in prostate cancer. So we had data presented there about a trial that was run in men who had really reached the end of their treatment course with prostate cancer. So these were men that were facing fairly imminent death. And the data that was reported showed that a combination of our drug with another drug that belongs to the big Swiss company Novartis did something quite remarkable for men, and it proved to be quite beneficial to most men.
So is that partly behind why the share price has improved, that this association with a big drug company's product makes you potentially more attractive, either in your own right or even as a takeover target?
Oh, I think all of that, yes, Peter. I mean, if you are a small company like us, wanting to be bigger, of course, but and you've got a drug that might have, say, sales capacity or potential of some hundreds of millions of dollars a year, you might think of doing that on your own. But this drug of ours, Vyondra, has got potential across most forms of cancer, and the sales potential, if we can prove that it does what we think it will do, we're talking about billions of dollars. Now that's beyond the scale of anything we can even remotely think of doing ourselves. So yes, we need to partner with a bigger company.
Okay, now for people who don't understand Vyondra, in a nutshell, what is Vyondra trying to do, and why do you think it's so good?
Okay, well, the whole focus on cancer therapy has now shifted to getting the body's immune system back on the job. So cancer flourishes because it's learned how to turn off the immune system. Yeah. And so everyone is now looking at how to get that immune system back on track. And there's a number of drugs and therapies that are doing that. The trouble is they don't work in enough people. They literally only work in about maybe 1 in 20 cancer patients. So the big hunt is on at the moment to find out how you can make those other drugs more effective. And that's what our drug is meant to do. It's meant to make those other drugs and treatments work in far more patients. So if we're, and what the data that was released in a month or so ago at that conference, it actually showed for the very first time that our drug is able to make a big difference to other drugs.
Now, you've got other programs going on as well. Tell us about those.
Okay, well, the immune system is quite complicated. So there's different ways that the cancer has up its sleeve to trick the immune system. So it's unlikely that there's ever going to be one treatment that suits every sort of cancer. So what we're doing is looking at using Vyondra in different settings with different combinations. And it's our view that ultimately doctors are going to need to be able to pick and choose different combinations to work in different patients. So we're running 4 different programs at the moment. all of which are looking at different combinations of drugs in different types of settings.
Okay, now a lot of us aren't all that experienced in the trials and tribulations and challenges of a company like yours, but if there's three letters in the world that most of us are afraid of, it's FDA, and that's the Federal Drug Administration, and getting approval, and clearly that's really important for a company like yours. So where are you at now, and what has to be achieved for you effectively to get that thumbs up from the FDA?
Okay, well, the FDA has pretty clear reason for being. One is that they want to make sure that any new drug doesn't make things worse. So you've got to be safe. The second thing that it has to do is to work. Yeah. And so we've achieved the first thing. We've proven that our drug is very well tolerated. So we've managed to tick that box. The next box we have to tick is, does it work? And that in cancer patients, as far as the FDA is concerned, that means, can you get patients with cancer to live longer? Yeah, okay. So you have to beat the current survival outcome, and that's what we're in the process of doing. And we're probably about halfway in the process of doing that. So we're currently in phase 2. The next big step is when you're satisfied that you've got a drug that's working, you then go into this so-called phase 3 study, which is a blinded study. It means that you, the doctors, the patients, don't know whether you're getting the active or a placebo treatment. And that's the only way to ever prove that your drug is working. So you don't go into that until you're pretty damn certain that your drug is going to work. Because a phase 3 trial is quite expensive. Now, we believe our goal is not to run a phase 3 trial ourselves, but to have formed a partnership with a major company who will do that. So our goal is to get a major company convinced of the merit of our drug, and that's what we're doing now, and that's underway.
And have you got past the phase 2, or that's what you're working on now, and then that would be used to appeal to a big company as a likely partner?
Yeah, well, the data that we spoke about at that prostate cancer conference recently, that was about a phase 2 trial. But we're about to go into other trials that are all phase 2. So I'd say we're just in that phase now. So this is a 2 to 3 year period, and we're 1 year into a 3-year program to prove that.
And also, you've got a new subsidiary called Pharmarage Proprietary Limited. Tell us about that and why you've done it.
Okay, well, this came purely by chance. We 2 years ago, we knew that our anti-cancer drug Vyonda had an anti-inflammatory effect. Now, that might seem an odd connection to most people, but the reality is that cancer starts from inflammation. So having an anti-inflammatory drug can be a useful way of treating cancer. And the number of cancers, they do actually use anti-inflammatory drugs. So we went to a big medical research institute in Melbourne called the Hudson Institute. They had a reputation for looking at anti-inflammatory drugs. We said, here's our drug. You tell us whether this has got an anti-inflammatory action. They came back about 12 months ago and said, yes, it does. And it's an extremely interesting anti-inflammatory action that, in fact, have you actually thought about using it, not just as an anti-cancer drug, but as a way of treating patients who have got sepsis? Now, I probably knew only a little bit more than you did about sepsis, but it turns out that sepsis is a major killer of people in the world. In fact, 20% of all deaths in the world are due to sepsis. And as chance would have it, 1 month later, so in March last year, the Hudson came back to us and said, do you realise that the people who are dying in this pandemic are dying from sepsis? So we thought, well, let's now we really need to take this drug into patients with who've got COVID-19 disease and test the drug. That's what we're doing. But in the meantime, we've discovered that our drug is working in a very unique and a very important way in blocking sepsis. And we thought, this is too big an opportunity to pass up. So we have created this subsidiary Pharmarage, which involves a number of research institutions, including the Hudson Institute in Melbourne. And the whole idea is to use this technology as to come up with drugs that treat conditions like sepsis, which sepsis is really, it's an inflammatory response to damage in the body. That's a whole other area which is outside of oncology. So it just made sense for Noxopharm to put that into its own little home, and it can go off and do its own thing.
Okay, so Noxopharm owns Pharmarage.
Noxopharm has actually got an emerging pipeline, not just Pharmarage, but it's got anti-cancer drugs other than Vionda. So if I was able to put an optimal, the deal I would put together that I would like to see done is one that saw Vionda go off and find a separate home that would then bring in a lot of money to the company, and allow Noxopharm to continue on doing what it does.
Okay, Graham, is there anything else you think anyone should know to understand your company? Because this is the point of this exercise, for people to understand the company.
Sure. Well, look, Australian investors are really spoilt for choice when it comes to biotech. And there's over 100 companies now listed on ASX involved in drug development. So there's a lot of choice. I think you need to ask yourself if the chances of success are the same with any drug, and it's a high hurdle to have to jump. Then look at what the potential payoff is going to be. And in the case of Noxopharm with Vionda, I would state quite categorically that this potentially could be one of the biggest payoffs of any biotech company, not just in Australia but in the world, providing we can demonstrate that Vionda does what we believe it will do. That's a very big prize that's waiting to be picked.
Yeah. All right, Graham, thanks for joining us, and good luck with that.
Okay, thanks, Peter.